everyone. Welcome to the fourth session of Nat Health Leadership Reach Out series for our frontline health warriors. I'm Anvesha Pandey, Deputy Director at Nat Health. There has been an urgent need to address the health and wellness of our healthcare frontliners, as this pandemic, has had devastating effects on all of us and has especially stretched out our healthcare system, especially our healthcare staff and frontline workers. They have been the strongest workforce in healthcare and have helped us in managing this pandemic so far. They are warriors in true sense, as they are at the forefront of the war, saving lives. They are facing vulnerable times with stress, mental breakdowns, physical exhaustion, and have little time for personal and often are stressed out to keep themselves safe from the virus and their families also safe from the virus. And to help our frontliners, Nat Health has initiated this series. Every week, we have a select group of healthcare leaders and mental health experts who will speak directly with our warriors. Today, we have an eminent speaker, Dr. Sameer Gupta, with us. Welcome, Dr. Sameer. He is an American-trained and boarded, highly skilled cardiologist specializing in complex interventional cardiovascular, structural heart and peripheral procedures. He's the director of Umkal Hospital, Gurugram, the group Cath Lab director of Metro Group of Hospital in Delhi, and managing director of Aurum Senior and Assisted Living in Gurugram. He is the host of popular weekly health segment on NDTV called Doctors on Call. A passionate healthcare advocate, he has health awareness platform called Voice of Healthcare with a loyal following on Facebook and Instagram. He is regularly invited by various national and international media platforms to discuss health-related issues that affect us all. He was awarded the status of extraordinary ability and achievement by the United States government in 2013. At the Times Healthcare Award in 2017, he was the only cardiologist to be awarded the Young Achievers Award. He has been given the prestigious state of Fellow by the American College of Cardiology and Society of Cardiovascular Angiography and Intervention. As a recognized leader, he is the co-chair of Healthcare Committee at PhD Chamber of Commerce. After training and working in the United States for almost 10 years, he has returned to India to deliver world-class healthcare to his country and its people. He routinely performs complex coronary, structural, and peripheral vascular procedures on the arteries and veins. I suppose I could understand, I could make more sense of this, but yes, I do get some idea that you are a specialist in heart surgery and you're a cardiologist. He's regularly invited at various national and international meetings to present his research and complex cases. He's one of the few doctors in India who is board certified by 5 American boards: internal medicine, cardiovascular disease, interventional cardiology, echocardiography, and endovascular intervention. In the pandemic, not only he went into the frontline actively seeing COVID patients, but also played an integral role in the leadership as the hospitals ramped up their efforts to meet the increased demand and challenges posed by the pandemic. A very warm welcome to you, sir.
Thank you so much, Anvesha. I think this is an excellent initiative by Nat Health to try and educate people and deal with, and more so the healthcare workers who are at the front lines. I want to commend you on this effort. Thank you so much for having me.
So, yeah, thank you and welcome once again. So for this entire session, we will be focused on how do we help our frontline workers manage the stress, because it's hit them badly. I mean, it has hit everybody, but they are fatigued, they are stretched, and so that's why we have initiated the series where we would try to do our bit to help them, to talk about their mental well-being. Are there any opening remarks, anything that you would like to say before I start throwing questions at you, which have been given to us by the frontline workers itself?
Yeah, I would just like to take a moment and just and let's just talk about how we kind of reached here. if you think about it, this entire disease pandemic it's really not that old, right? I mean, on the 30th of or 31st of December 2019 is when the first report came out of China that we found this new virus. And it was soon after that the New England Journal publication came out, which said, they decoded the virus. And we had we saw what happened in New York and then Italy in early March. And on 22nd of March, which is about only 14 months ago, when India went on lockdown, right? I mean, 22nd of March was Janta curfew and 24th of March was lockdown. And ever since then, the healthcare workers have been at the front line. We had the first wave, the numbers went up, but really not that much, right? I mean, when we were seeing New York, when we were seeing Italy, what was happening over there, we were expecting what happened this month. We were expecting that last year. And we kind of were waiting for it, but it never really happened. The numbers did rise. The front, we all went to the front lines. We got ramped up. We were able to get all our PPE suits and sanitizers and all that stuff which is required. And we peaked at only 1 lakh cases, which was kind of surprising for everyone across the world. And then, and then Diwali happened. And then Dashera happened, and Diwali happened, and people went out, and the New Year happened, and we said, okay, now the cases will come up. And then there were all these rallies, and we were like, now the cases will come up. And we all just waited, and the entire world watched and said, oh, you know what, maybe India has beaten the pandemic, and everybody was giving each other high fives. Oh, good job, we are used to living in dirt. That's why we are this thing. We have a strong immunity, the BCG vaccine. And then all of a sudden, the numbers went up and the second wave started. Yep. And it was actually devastating. I mean, nobody anywhere in the world expected the second wave to be where it was. 4.25 lakh cases a day. Incredible amount of disease, incredible amount of suffering, and all the healthcare workers, all of us batted from the front foot. We came forward. We said, I've had innumerable conversations with healthcare workers across the country, many who are working with us in our hospital groups, and many who are not working with us are our colleagues from across the country. And we all had discussions, that everybody was scared, everybody was anxious. What do we do? And one thing which came forward was, if I was to say it in Hindi, it was, ye aage badhne ka samay hai, piche hatne ka nahi. It's the time to move forward, not step backwards. And I hardly know of anybody who did not bat from the front foot. They were anxious, there was suffering, and these kind of outbreaks, they put the maximum people who are affected are the healthcare workers. There's a constant increasing. You see so much amount of cases. The hospitals are flooded. There's a rise in the rate of deaths you are seeing. There is, in the first part of the pandemic last year, there was no vaccine. There were hardly any medicines, right? I mean, and so that added to the stress. There was so much amount of media coverage, and irrespective of who you are, where you are, you cannot be immune to the media coverage. You cannot be immune to WhatsApp University, the University of WhatsApp. You do read these messages. There was a question initially. There was a feeling of inadequate support from in the healthcare workers, in the staff, and everybody, and that led to the stress and anxiety. And when the case numbers went up, especially this year, ever since last year, I hardly know of anyone who's taken a vacation, right? I mean, we've been there working 24/7. If not 24/7, at least you've not gone away for a 2-week vacation, like you would. Medical conferences are canceled. Everything is canceled. So, people have been working extremely hard. And I want to commend and compliment every one of you who's watching right now on the outstanding work that you've done. And I think it's a great deed we're doing for humanity.
Very true. I resonate your thoughts. We are actually thankful to everybody in the health fraternity, and, especially our frontline workers, because they have been there fighting day in and day out. So just to start with this question and answer session, I would throw my first question to you. The current systems, as we both know, and you also mentioned, it's actually overstretched at the moment. So what initiatives you have taken in the two hospitals that are you associated with Umkal and with the Metro Hospital? What are the initiatives that you have taken at your hospital, and what advice to other hospitals on any good practices that you have initiated you would give?
So when the pandemic started, right? So things started going down in February, like I said, and then and the case numbers started increasing in March, and then all of a sudden we all were faced with a challenge that it's time to ramp up services. In the first part of the pandemic, if we go back, so across the metro hospital group, we have about 12 hospitals. In the Umkal hospital is one hospital in Gurgaon, and some of these hospitals were not COVID hubs last year. So, depending upon where the hospital was located, what the infrastructure available was, some were COVID centers and some were not COVID centers. This time, when the numbers started increasing, especially in Delhi and UP and Gurgaon, there was no option but to become, all of them had to ramp up to take the COVID patients. And there was those places who were treating COVID last year, for them it was the systems and setups were already in place. And those which were not, we felt a lot of anxiety amongst the people, amongst the healthcare workers, whether they were doctors, whether they were nurses, ward boys, whether they were the housekeeping staff. Everybody was a little anxious, what's going to happen? How are we going to deal with this? Are we set up? And I think a lot of it was to try and set up systems and process in place that, don't worry, we'll all get in together. We had regular meetings with all the stakeholders, whether they were the nursing, whether they were the housekeeping staff, the medical superintendent, the different doctors of all the specialties, as to how do we deal with this entire pandemic, creating a separate donning area, a separate doffing area, getting adequate rest places for all the staff, many times giving them nutrition and giving them meals. That played a very important role in reinforcing how the hospital cares for its staff members. We ended up giving a lot of some of the people, actually majority of the people were also given some level of COVID allowances to try and reinforce that that we are in this together. This is important for us to deal with it. And I think communication, and Vesha, goes a long way. Communication is often not stressed, but it is one of the most important things in the team. And we had regular meetings with all these people, with all our stakeholders, with all the hospital staff members, that what are the challenges that you foresee when you talk to your team, when you talk to that on-ward sister or that on-ward nurse, how is she feeling? What can we do to mitigate some of the concerns that she has? So, we invested in high quality. So some of the feedback we got was, I'm scared for myself. I'm scared for my family. What if I get sick? Where will I go? Can I go home or not? So these were some of the major concerns that came up amongst all the healthcare workers, and we mitigated a lot of these concerns. We gave them COVID allowances. We assured them that if anybody is to get sick, then there would be prioritized admission either in our hospital or in our hospital system somewhere. And that did happen. Some of our healthcare workers did get sick, and we accommodated them in our healthcare system. We gave them the best of care that we would have given anybody else. And these are some of the things that came up, and we always have an open door policy. I have an open door policy, and that people come to me and they come with their concerns, and the same thing as the leader or the director of both the hospital groups. People come up to us and they share their concerns, and many times they just want somebody to listen. Sometimes you just have to be that ear to listen to these people, to listen to the concerns, and maybe you can give them some advice and give them something. And sharing your personal experiences has also gone a long way in mitigating some of the concerns that are there. We have in our hospital systems, we have psychiatrists and we have psychologists, and we've encouraged many people that that if they have any concerns, if they are feeling anxious, if they are feeling something depressed, or then please go and seek help from a medical professional also.
So that's very great initiative. You talked about allowance, and you talked about a mental health expert, a psychologist being around there for the frontliners. So these are like really great initiative. We did talk about that how they are also quite concerned about keeping their families safe. At the same time, we also get questions from these frontliners that they are not being able to save enough patients. Seeing anybody die is not easy for anybody. I mean, not for you, everybody, even doctor, and everybody is human. So what would you suggest that how do they come out of this guilt feeling that they have done their best, and some people did die and they did all their best. So so the question is like, how do you help them overcome the guilt feeling of not being able to save enough patients?
This is something that I can speak both from my personal professional experience and also as a hospital administrative leadership staff. Um, so as an interventional cardiologist, you deal with very sick people, right? I mean, there are people who are coming in cardiogenic shock. There are people who are coming after a heart attack, and many times you try your best. Some of these people are young. They have families. You've talked to the families 2 minutes before, and then you go and you operate on these people, and some of these people don't make it. Some of them die on the table, and some of them die in the ICU or the CCU, and that's the reality of the medical professional we work with. What has happened this time, Andesha, is that this has been amplified to a magnitude which has not been seen before, right? I mean, a month ago when Delhi was peaking and the case load in Delhi was 28,000, I personally was getting hundreds of calls a day. Other doctors in my family were getting hundreds of calls a day, and it was this constant stress that was going on. Like, and these were people who, many of whom you didn't even know. They were like a friend's nephew, a of our aunt's friend's brother. So these were people who we never really knew, but people were reaching out and they were seeking help. And it was a feeling of helplessness. And I completely understand that because I felt this. I felt this both as a doctor practicing cardiology, and I felt this as an administrator when I'm dealing with all these things. And it's a bad feeling to have. It gives you this sinking feeling. But then what you do in these situations is what one of my mentors taught me when I was training in the US. He's like, you go back and look at your success stories. And they will far outnumber your stories of loss and grief. And what has ended up happening is that, all these patients, when they get discharged, they send you a note. Many of them have sent me a note. Thank you so much, doctor. If it was not for you, my brother would have died. If it was not for you, my mother would not be there with me. Now, and you get these messages and you circulate these messages. You read these messages again and again and again, and you get this sense of fulfillment of how you have actually been able to make a difference. This is the practical thing which has worked for me. And then, and one of the most important things is you have to be true to yourself. You know that you have tried the best that you can do, and that's all that we can do. Because there is still, in this disease, and there's a lot we don't know. There's a lot we don't know, and there's a lot that we are grappling with. Whether it's the pathology, whether it's the vaccine, whether it is the treatment, whether it's how the virus responds, there's a lot we don't know. So, with the resources that we have, with the limited resources, both in terms of science and in terms of the healthcare infrastructure, it's important that you be true to yourself and say, you know what, I gave it a best shot. And even if these people have not lived, there are so many more that I have been able to save. And read those messages. And I would encourage all the healthcare workers out there to read those messages that they've gotten in their WhatsApp groups and all these positive stories, because these things go a long way. And what happened last month in Delhi was just unprecedented. Nobody had anticipated it. Nobody knew what the outcome would be. The oxygen shortage, the PPE, the medicine shortage, the constant stress in the hospital. When I would go around and when I would get these calls, it was like the emotions were high. The emotions were high, not only of the family members and the patients, but also the healthcare workers, because the healthcare workers were stressed. The patient was stressed because he was not well, and the family members were stressed because, at that point of time, it was like, if you've got COVID, oh my God, I'm going to lose him unless a miracle happens, right? I mean, that's what we were seeing, which was not the case, but that is what ended up portraying out. So I think it is important that you go back and look at the success stories. It's important that all of you head of departments out there, the healthcare leaders, you share these stories, feedback from the patients that you've gotten onto your staff, onto your WhatsApp groups. Go back and pat the back of all your healthcare workers. You're doing a good job. I know you have not, you've worked without a break for the last 1 month, but you're doing it for the greater good of mankind. ये आगे बढ़ने का समय है. Some of these things really, really have gone a long way. Really have gone a long way. Encouragement and support from the team members.
Yeah. While I, Dr. Gupta, while I do acknowledge that some of the patients, and even I have done it at times, you thank the doctor, you thank the hospital when you walk out of the hospital, after you are being treated. But at the same time, there have also been instances when the patients, maybe when they're not very happy or something happens to their patients or their relatives in the hospital, there is a lot of, violence that happens at the doctors. The doctors are beaten, they shout and howl, and, sometimes they just damage the property. So what advice would you think, and how should we deal with that? What is the advice that you would give to the people on the hospital to manage it?
Yeah, so this is something which we have been grappling with as healthcare workers, as hospitals, and as a society for the last many years. Many years. This is not something new, and we've often talked about it on various platforms, that this is actually absolutely unacceptable. Violence against healthcare workers should be a criminal offense, because no healthcare worker in their right mind would ever do anything to try and sabotage the life of another patient. Nobody would ever do that. At the end of the day, every doctor, every healthcare worker does the best that he can or she can with the resources that they have, with the knowledge that they have, because for any healthcare worker, for any doctor, any nurse, a live patient is much better than a dead patient, right? And a live patient is going to go spread your name out. He's going to tell 10 more people and you will get 10 more patients. Your practice will grow. He will speak good things about you. So nobody ever does it intentionally, right? And this is actually absolutely unacceptable. And usually what we've seen is that whenever this violence issue comes out, it is for two reasons. One of which is either the patient has died and now they don't want to pay the bill. This is usually the case that has panned out many times when these situations happen. And this is the unfortunate reality of where we are. But if this is to ever happen in any of the hospitals because of high emotions and everything else, then it's important that we should do an FIR immediately, call the cops, tell them to take care of it, because the healthcare workers right now are working under extreme circumstances of mental strain, physical strain, and the last thing they want is unappreciation and ingratitude, for so to say. And violence is actually absolutely unacceptable. One thing I would like to point out, Anvesha, is that as a medical society, as a medical community, what has ended up happening is that when a doctor treats a patient, right, you often you want to do the best that you can. But if you start getting inklings, and I've heard this from a lot of people in tier 2, tier 3 towns, where some of these things are more common. Not that they're not common in tier 1 towns, they are very common in tier 1 town like Delhi and Bombay, but even Bangalore, these things do happen. But in the tier 2, tier 3 towns, this is a little bit more common, I would say, from what I understand. And what ends up happening is that these doctors now don't want to take sick patients. They don't want to treat these people. So the end loss in the long term, because there is a sense of distrust that the patient or the family may have with the doctor or the hospital, an inherent sense of distrust, even if they don't know the doctor or hospital. Is he doing the right thing? Is he going to? What if my patient dies? When this distrust comes in, nobody wins. The doctor is hesitant on treating the patient, and he doesn't want to do anything too complicated because he's like, I don't want to bear the brunt. So in the end, it is the patient who is losing. It is the family members who are losing by doing all these things. So this is actually absolutely unacceptable. This should be an FIR, no doubt about it.
Sure. There have been some questions floating in, and I'll just take a couple of them. There's one question. There are actually a few of them. I'll just take them one by one. So, what is the piece of advice you have for the Indian population in general who even now do not follow social distancing norms or wear mask properly? So,
and Desha, I'm sorry, your voice. There was a problem in the connection.
Sorry.
I couldn't hear.
Am I clear now?
Yes.
So I was just saying, I'm getting some questions from the audience, and I'll just take them one by one. So there's this question on most of the Indians or the Indian population in general not even now following social distancing norms and not wearing masks properly. So what would be your piece of advice to them?
So this is something, human beings are human beings, right? It's difficult to try and control them. I'll tell you, in fact, Anvesh, I'll tell you an incident that happened in our hospital, right? There was somebody in our hospital when the oxygen crisis was going on. There was one person in our hospital, and his only job was to go stand in line and get oxygen. Okay, he would go for 8 hours, 7 hours, 6 hours, stand in line, fill up 20 cylinders, come back to the hospital. In the meantime, those 20, 30 cylinders were empty. Then he would take those cylinders and go back. One day I was talking to him. One day I was talking to one of the healthcare, the staff in the hospital, and I said, "Where is he gone?" Like, he's gone for a wedding. I'm like, well, it's the midst of the pandemic. How can he go for a wedding? I mean, is there a wedding happening? And he said, yes, he's gone for a wedding. I said, okay. I said, it was apparently his sister's wedding. He'd applied for leave more than a month ago. And the wedding did happen. It was somewhere in eastern UP. When he came back, I asked him, I said, how was the wedding? He's like, oh, it was very good. I said, okay. I said, how many people were there? He's like, sir, the entire village was there. I said, entire village was there? And I'm telling you, Nisha, this is 3 weeks ago, literally 3 weeks ago. I said, the entire village was there? What do you mean? What, there were 50 people? Was it a small wedding? Like, no, sir, the entire village, 500 people were there. So, and this is the healthcare worker who is seeing the devastation, who's seeing death, and he knows about the oxygen shortage. And this is what his reaction was, that there is no COVID over there. And now we all are hearing stories from that part of the country. So just remember one thing. It is not if you don't follow the social distancing norms, if your mask goes here, and then it finally settles on your chin, it is not a question of if, it becomes a question of when. Because we know the science. The science is very clear. If you don't follow social distancing, if you don't follow mask, if you don't follow the precautions, you will get infected. And not only will you get infected, you will transmit the infection to multiple people whom you love. I'll give you an example of what happens as healthcare workers. So where I live, my parents live on a different floor. They're also both doctors. They're currently working from home. They're doing all teleconsults and all the management they're doing from home. I don't have dinner with them anymore because I'm exposed to COVID. And I want to keep them safe. And even last year, when the numbers were high, I would wear double mask. I would go meet them, and then I would come down and I would meet them for 15 minutes just to say hi. I would wear a shield and a mask and meet them, change my clothes and meet them, and then I would come back to my house and I would eat dinner by myself. I still do that because I don't want to be that person who gives them COVID. Right? So you don't want to be that person who gets COVID in your house. So if you don't take precautions, if you don't take the adequate things, then you will get COVID in your house. And you may do fine, but your father, mother, your wife, your sister, your daughter or son may not be as lucky. So you have to take those precautions. You have to understand the science, and it's important for you and the safety of your loved ones.
Exactly. Exactly. Very, very well answered. So very well. So the second question I will take from the audience, which is coming up, is even now we see there is some sort of resistance among population against the vaccines. Many people are worried, still worried about the side effects of vaccines, and even now are against taking those vaccines. So, how do you think we should address this challenge? So, this is again from our frontline workers that has come.
Anvesh, I'm sorry. Let me disconnect from my Bluetooth. I think there is some problem. I missed your entire question. Give me 1 second.
Can anybody else also face the same thing, or is this a problem at my end? Maybe I'll change my network then.
No, I disconnected my Bluetooth. I don't know if it's the Bluetooth. Now I can hear you loud and clear.
Okay, so the second question was, in general, there has been a resistance. We do see some resistance against the vaccines, and people are not very keen. There is a lot of things that has been floating around. Like some people do say that if they take vaccines, they would get imported or something like that. So how do you think we should address that?
So, it's back again, right? Education is one of the most important things in the fight against the pandemic, right? Now, if you go back and see, so let me tell you this thing. Vaccines are very safe. If you go back and see how vaccines were developed over a period of time, the number one public health, the biggest public health achievement of humankind has been vaccinations. The second being antibiotics. Vaccinations are one of the few ways in which you can completely eradicate a disease. I'm not saying COVID can be eradicated, don't get me wrong, but it's one of the few ways in which diseases are eradicated. And we've seen that with smallpox, right? We've seen that we've seen how the numbers of hepatitis B have come down drastically over the years. We've seen that if you don't get the measles vaccine by the anti-vaccine groups in India and abroad, then there is going to be a measles outbreak. Right? We know that. We've seen that. So if you don't get vaccinations, the chances are you will either get COVID, and if we as a community don't get vaccinations, then COVID is just going to continue to increase.
Yeah.
I have gotten vaccinations. I know everybody in my family has gotten vaccinations. I have not faced any of the side effects that people were talking about. No, I don't know of anyone who's had any of these side effects. They're very safe. At maximum, you may have a little bit fever and chills for a day or two, and they go away. In fact, Anvesha, when I practice cardiology, when I put my hat of a cardiologist and I practice cardiology, and there are other times when I'm doing other administrative stuff, running the hospital group. So when I'm wearing my cardiology hat and I see patients, and I think the vaccination drive started for above 60 in the first week of March. And the inkling of it, we started getting in the middle of February. I started asking my patients. I said, every patient, the 20, 30 patients I see, everyone I would ask them, are you going to get the vaccine? Are you going to get the vaccine? And there was a lot of hesitance initially. But then over a period of time, that hesitation went down. And people would often say, you know what, I was just waiting to see you before I decide or not. So it's important for all the healthcare workers to reinforce the importance of vaccination and talk about vaccination in particular with all your patients and family members, because it's only with correct education will this vaccine go. Now, people often ask me, like yesterday I was on a debate and they were asking about the third wave. Oh my God, we're going to get the third wave. They're saying the third wave is always worse than the second wave and the first wave, and so on and so forth. Let's try and understand how this entire thing is going to play out. Okay, let's try and understand how this entire thing is going to play out. We've had 4 lakh cases a day, right? Now we are down to 2.5 lakh cases a day, approximately. Now, yes, a majority of these cases are in now tier 2, tier 3 cities where they don't have adequate vaccine, where they don't have the adequate healthcare infrastructure. The healthcare infrastructure is totally in shambles over there. There is no testing. So if there's no testing, there is hardly, the treatment is not as high end as it is in big cities where some of us live. So if there is no testing, this does not count in the tally the 2.5 lakhs, right? So
Mhm.
there are many more cases right now, possibly in tier 2 and tier 3 cities. The only reason the numbers have gone down in Delhi and Bombay is because of the restrictions, because of basically curfew, lockdown, whatever you want to call it. The shops are closed, the malls are closed, the restaurants are closed, all spas are closed, gyms are closed, schools are closed, colleges are closed, most businesses are closed, right? Now, this cannot go on forever, right? This cannot go on forever. At some point, things have to open. At some point, people have to go out. At some point, people will want to go out. At some point, people will want to have bigger marriages, like they do, 100 people, 200 people, 400 people, whatever. Now, if you don't get vaccinations, if you don't get vaccinations, and you go out to these things, these events, the virus is still going to be around. Somebody over there in that mall, in that wedding venue, is going to have the virus. That person is going to cough. He may be asymptomatic, or he may have early symptoms, and he or she will probably think this is the allergy season, and that is why I'm having a cough and I'm having a runny nose. Or I had cold water, मैंने ठंडा पानी पी लिया था, इसलिए थोड़ा बुखार हो गया, गला बैठ गया. Or I slept directly under the air conditioner, and that is why I have a fever, right? Because nobody will really think I have COVID. Nobody will even want to believe that they have COVID.
Yeah.
And they come up with these thoughts in their head. So this person is going to cough, you're going to be at the same event, you're not going to be vaccinated, and you will get COVID, right? The chances of you getting COVID are much higher because you don't have any antibody, you don't have any vaccination. So the chances of you getting COVID and getting sick are much higher. So the question is, what is worse, me getting the vaccine or me getting COVID? And I think the answer is pretty simple.
Yeah. But there has been instances that we hear that even after you have taken the vaccine, there are chances of you getting infected. And there have been also cases where people have taken both the shots and still they are infected. So what would you say on that?
Absolutely. This is something that we are seeing a lot of, right? I mean, we all know of people who, after first dose, have gotten COVID. We know people after double doses have gotten COVID. We've heard of the luminary doctor who died after double dose of vaccination. But these instances are very few.
Yeah.
Right? These are very few. After double dose, people dying. Very few, very rare. The chances are that the antibodies that you develop, the immunity that you develop from COVID, from the COVID vaccination, is going to help your COVID become either asymptomatic. From mild, it may become asymptomatic. If you were going to get moderate, you may now get mild. If you were going to get severe, you may now get moderate or mild. So it reduces the severity of infection drastically, and we are seeing that, right? We are seeing that because given the mortality and morbidity that we are seeing in people who are not vaccinated compared to those people who are vaccinated, the numbers are much lower. They are much lower. We don't have data to show this, but I can tell you that from my anecdotal practice, that anecdotally, that all those network people who are calling me up and all these things, I'm definitely seeing a much lesser severity in those people overall than those people who don't have vaccines.
Yeah, totally. Thank you so much for that. I'll just take one more question. So the question is how to manage cardiac patients when they are COVID positive, especially when there is a sudden fall in the SpO2 level from 95 to 75.
Yeah, so this is definitely something which is important. So we do know that cardiac patients. So if you go back and see when the first wave of vaccination started, right? They started once again on the 1st of March, and that time the government said anybody who's more than 60 years of age, or if you're from 45 to 60 and you have a certain set of comorbidities. These comorbidities included people who had cardiac disease and included angioplasty and stents and heart failure and low ejection fraction. Those were included in that. So this population of people are definitely at a higher risk of having bad outcomes. That is why they try to include that subset of people in the vaccination set, in this vaccination subgroup. So now that we have that thing sorted, when you have heart disease, you do require, or any of the other risk factors, right? I mean, if you're a cancer patient, you're on immunosuppressive therapy, you have lung disease, you require very close monitoring. You require very close monitoring with the SpO2, with temperature, and it is important to immediately establish care with a doctor and keep that person updated with your day-to-day status. Right now, all these WhatsApp calls are happening, Zoom calls are happening, where the doctor and patient are able to interact, discuss the current level of symptoms that the person has, and keep that person up to date with everything. Now, a sudden drop of oxygen saturation from 95 to 70 is usually not seen, right? I mean, it's not that it happens in a second. It happens. It happens over a period of time. That time may be a few hours, right? When you will see that drop started to happen from 95, it'll go down to 94. It'll go down to 80. Or 94. It'll become 90. It may become late 80s, and then there can be an immediate cytokine storm, and then things can go south. So at the first sign of things going south, you need to start considering a hospitalization. Okay,
Yeah.
especially if you're a heart patient, it's better that you be observed and treated in a hospital compared to being treated at home. One more thing I would like to tell you, Invasion, to all the other healthcare workers, or maybe not the healthcare workers who are here, is that what we are seeing, and what I have also seen in our practice, is that in the midst of the pandemic, right, when everything was in shortage, right, there was no oxygen concentrators, there was no oxygen, there were hardly any medicines, hospitals were overflowing, people created these ICUs at home, right? There was a lot of trend of ICUs at home where they got a nurse, they got oxygen, and they started treating people at home. That was kind of a stopgap solution. That, since there are not enough beds, let's try and do some of the monitoring and stuff at home, and then when things go south, we will try and go to the hospital. If you do this, the second you start seeing an inkling of you requiring oxygen, because now, at least in Delhi NCR and in Bombay, the situation is better, beds are available, the bed capacity has been ramped up, oxygen problems have gone down. So things have kind of stabilized. So as we speak, if you do have any of the symptoms, I would encourage you to start considering a hospitalization, because there you are under constant care of a nurse, you are under constant care of a doctor, and the quality of the nurse is probably going to be better than the quality of the nurse that you have at home. The monitoring that you have over there, the fine tuning, as we call it in medicine, right? Increase this dose from, X to Y. That can happen on a minute-to-minute, hour-to-hour basis compared to doing it at home. So it's better now that things have stabilized. If you are a heart patient and you see things going south, if you see your oxygen saturation starting to drop, then start considering a hospitalization. You may be better off over there.
Okay. So that's very insightful. Thank you so much for your time. And like all good things have to come to an end, I guess it's also time for us to wrap up. Ramp up. So any piece of last words, any last advice that you would like to give to our viewers before we close this session?
Yeah, so I know the entire thing was about advice, counseling, and support for our healthline workers. I'll share just one small anecdote in Malaysia. What happened. Once again, I go back to a month ago, because that's when things were the worst. We were all extremely stressed. I mean, as hospital people, you're getting a call, I don't have oxygen, and you're like, I have 100 patients in the hospital, we don't have oxygen. And so the stress level was of a different level. It's unfathomable what was going on. So what ended up happening was, I remember thinking to myself, I'm like, this is crazy. I get up in the morning at 6 and I already have 10 phone calls and 10 messages. And then during the course of the day, the phone doesn't stop ringing, and I'm going to go crazy. This is not sustainable. So what I started doing was I started taking about 15 minutes in the morning and 15 minutes in the evening just for myself. I would get up in the morning and I would just sit by myself, have my cup of coffee, keep my phone away from me for 15 minutes, and I would just and yoga and meditation go a long way for some of you to do that. Go for a run. It's a great stress buster. Wear your mask when you go for a run. You don't know what bug you may pick up outside. You can do yoga in your room. Just try and burn some of the heat and energy that you may have. And the evening time, before I would sleep, I would finish all my phone calls and, just check up with all the ICUs and all the hospitals, how they were doing, what the bed situation was, etc. And then we would, before you sleep, I made it a point to read. I really enjoy reading. It's a big thing for me. And I said, I'm going to read. And I started reading a book. I enjoy reading. So I said, I'm going to read a book. And for those 15, 20 minutes when I would read a book, it was so enjoyable. I don't think I've ever enjoyed reading the book as much as I did during that time, because it kind of gave you that level of sanity back. It reminded you that, things can be normal and they will become normal, and COVID is not here permanently, right? I mean, COVID is kind of here permanently. The way I look at it, there will always be kind of a COVID ward in the hospital. I don't think it's like there's it's going to be like the flu. That, you always have 1 or 2 patients with swine flu here and there. So it might be similar to that. It's not going to go away forever. So we have to learn to live with it. But this craziness that we are seeing right now is only temporary. It's not going to be here forever. It's not sustainable. And not only do we need vaccinations, we need a good treatment for the disease. If you see HIV today is like having diabetes. Not exactly like diabetes, but you have good treatments for it. So you take your medicine and you can get your viral load under control. You can get all the other things under control, and you can pretty much lead a normal life. So we have a good treatment for the virus. So similarly, we need a good treatment for COVID. So to say, so we need a good treatment, and that treatment is on its way too. The best medical minds in the world are at it, and I'm certain that we will get a good treatment for it soon. So just remember that this is temporary. It's going to go away. Things will get better. Keep your chin up, and I'm sure you guys are doing the best that you can, and that's all that's important.
Thank you. Thank you so much. So things will get better from here, and we need 15 minutes of me time, do meditation, do yoga, go for a run. So that were the words of wisdom from our eminent speaker, Dr. Sameer Gupta. Dr. Gupta, it has been an immense pleasure to have you. Thank you for all those answers. I'm sure our frontline workers are watching the series will have benefited immensely with this session. Thank you. Thank you once again. I also want to thank deeply from my heart the entire healthcare fraternity and our frontline workers who have been at the forefront. Nat Health expresses gratitude to all of you. We will continue the series, and I'll connect with you again next week with another inspiring leader. Till then, goodbye, keep safe, and take a very good care of yourself. Thank you.